get a little bit more closer to the joint, you could do that. Hold on to the proximal end of the tibia, do a little traction, or, yeah, traction, okay. So that would be an appropriate option. Say they have some issues with their ankle, some ankle pain, you don't want to be yanking on the ankle, so you can come up more proximally and do traction there. I would have him up higher if I was going to do that for him. Okay. So your femur is your convex side of the joint, okay? Femoral condyles look like this, like two big knuckles, okay? And then the tibial plateau is your concave side. And so we're going to mobilize the distal segment. Okay? So our glide is the same
Thank you, Mr.
direction
Axel.
as the motion we want to achieve, right? So for knee flexion, we would do posterior glide, right? Knee flexion would be anterior glide. So let's do the posterior glide. And we'll move our So we'll do a tibial posterior glide to increase the knee flexion. From the bottom of the
Sure.
Okay, so think about where the joint is at, how it's angled. So if you follow the tibia up, you'll be basically in this plane right here. Right? So find the joint line. And down a little bit. I'm losing my rib space, right? And we're going to go directly down towards the floor. So posterior glide. Is that looking? Yeah. Okay. So for an anterior glide, you could pull forward anteriorly on the tibia. You probably want to stabilize the femur, and you could do one hand on each side of the joint. I've done that before. Wrap my hand and fingers around the posterior side of the tibia. Pull directly forward. Okay. If you wanted to spend the time, you could strap the femur down with like a belt or something. If you wanted to use both hands to do the mobilization, you could do that. The foam roll here for the posterior glide is to give some space behind the tibia to allow it to move. So if we did not have that there, and the knee was flush with the table, if you're pressing posteriorly, you could have the tibia run into the bed, which would kind of defeat the purpose. So you do want to make some space back there. So half foam roll, rolled up towel, something like that would work well. You could also do these mobilizations with some knee flexion. So posterior glide would look like this. You would stabilize the femur, and you do a posterior glide on the proximal end of the tibia. Right? So remember, the surface of the joint is different now. So when it's down here, the joint is here, and then when we flex the knee, the joint is now here. Okay? So what I do is I kind of squeeze this way, so I stabilize the femur, mobilize the tibia. Okay? And look at my forearm here, right? Not going like this, going like this. Stabilize. And also could you do an anterior glide? I could do a prone. Go into no running something. How would you
Hindi yung blues, no?
Bro, sabi siya.
government.
So we also want to create some space for the tibia to move anteriorly, right? So then you would put the towel underneath the femur. You could do it that way. Yeah. Okay. Turn it around the back. Better? No, just off. Give me a thought. You do it posterior and
Anterior, slides that way. Same thing we just did. We're just, I like sitting on the foot for stabilization, and I can use both hands on the mode. That's the only thing I have.
Yeah, this is fine. I have a tool, but I could do it this way if you want. And then go back into my flexion, and then do my rotation.
And then we do both posterior and anterior, push your point, or just do the
I'm just doing posterior. Yeah. One second for the heat shift. Oh, okay. Because I was kind of on the fourth position. Okay, and then the other one's holding on your stomach. The other way, the way that I do it is I just come here and have it bent, and then I'll use my here, and then apply it that way.
Should we get into internal and external